Your x-rays show that you have severe arthritis of your knee. At this point, we have a few options. Conservative options remain, which would be injections, medications, therapy, and braces. But if those options have failed, our last option is to replace your knee with a total knee replacement. When we do a total knee replacement, it's very similar to like retreading tires. We do not remove your entire bone. We make specific cuts along the femoral bone, which is the thigh bone, and we make a specific cut along the tibial bone, which is your shin bone, and we resurface those with metal. Between those two metal pieces, there will be a plastic insert, which basically serves as your cartilage. That plastic insert will wear out over time, but they're hopefully good for 25 to 30 years. After total knee replacement, there will be some minor restrictions for the first 3 months. First of all, if it is your right leg, we do not want you driving for 6 weeks. If it is your left leg, then we do not want you driving until you are off of pain medicine and off of the walker. I also don't like my patients to kneel directly on a replaced knee for at least 3 months because your incision goes down the front of your knee, the anterior aspect, and I don't want that type of pressure putting on it for at least 3 months. Some patients complain of pain in that front of the knee while kneeling on it almost indefinitely because we do resurface your kneecap with a plastic kneecap and it feels like people are kneeling on a stone, but hopefully that will go away over time.